in gorgeous weather this weekend, but many long-term care home residents won't be able to enjoy any of it. Despite a dramatic drop in COVID-19 infections, many of them are still being forced to stay inside, and there are growing calls for the Ford government to loosen restrictions. Some advocates calling the situation tantamount to solitary confinement.
What is this province waiting for? Have these seniors not suffered enough? Open up these facilities. Let these residents enjoy what is left of their lives.
With the sun shining and temperatures warming up, this weekend was especially difficult for residents still unable to step foot outside. 90-year-old Heinz Ziebel hasn't left his Ottawa long-term care home since last September.
All he talks about is going outside. He said he wants to feel the sun on his face and he just wants to go out.
His daughter Esther Latkowicz and granddaughter Emily feel helpless. Like so many other families in Ontario, they're only able to visit him through the window.
It's a gamut of emotions. You have guilt because, it's the one thing that he asks for. He doesn't ask for anything else, ever. He just asks to go outside.
Advocates and some doctors are now calling on the Ford government to loosen restrictions and update visitation guidelines. They say the benefits of allowing residents outdoors far outweigh the risks, given the dramatic drop in COVID-19 infections at Ontario's long-term care homes. There are currently just 11 active cases. Compare that to the start of the month when there were 71, the start of February when there were 855, or the start of January when there were 1,140. And it is proof that vaccinations are working. 98% of residents have received one dose, and 90% of those residents have received both doses.
It is at this point beyond cruel and unusual to keep maintaining such draconian visitation guidelines when the numbers are at their lowest that they've been in months.
In a statement, a spokesperson for the Minister of Long-Term Care says we are nearing completion of offering both vaccine doses to all long-term care residents. And as we continue to vaccinate staff, essential caregivers, and other vulnerable groups, we are seeing positive effects. Until more people have the opportunity to receive the vaccine, we must continue to be vigilant in following public health guidance, especially as we are seeing the spread of variants of concern.
This is not difficult. This isn't rocket science. This is the time to open up visitation. It makes no sense why they are still acting as though we are at the peak of the second wave and keeping these residents effectively locked up. Like, enough is enough.
The Ministry of Long-Term Care adds they will continue to consult with the province's top doctors who, when asked this week, said there are ongoing discussions about loosening restrictions, but there was no clear timeline given on when that might happen.